which is anterior, which is posterior. So if ever smooth siya, rough, so that would be the anterior. Posterior, you have this rough or linea aspera. Yan. Okay, parts. So this one would be your femoral head. And within the head, you have a depression. We call this your fovea capitis. And then, you now have lateral to the head, you now have the neck of the femur. Then lateral to the neck, you have these two trochanters. Okay, one that is more larger, lateral, and more superior, you have the greater trochanter. And then one that is more found inferior and more medial, and it's smaller, so you have the lesser trochanter. Okay. So anteriorly, we have this structure that is found between the two trochanters. We call this one as the intertrochanteric line. So anteriorly, this is quite prominent. Posteriorly, we have this one as prominent, and we call this your intertrochanteric crest. And then within the intertrochanteric crest, you have this protrusional bone, and this will now be your quadrate tubercle. Okay. So then, a little bit lateral and inferior to your lesser trochanter, you have a small protrusion here. Di kay klaro din, but maklaro this this model, this one will protrude. So that would now be your gluteal tuberosity. Then you have your gluteal tuberosity. Okay. So below that, you now have the shaft of the femur. Okay. So posterior to the shaft, we have this line there, and we call that as your linea aspera. So you have two there, one on the medial side, so you have your medial lip of the linea aspera. Then on the lateral, you have the lateral lip of the linea aspera, or the medial linea aspera, then lateral linea aspera. Okay. Then here below, this one, you have your supracondylar ridge above the condylar ridge, supracondylar ridge. Right. At the level of supracondylar ridge, anteriorly, you have this surface. We call this surface as your patellar surface. Posteriorly, you have another surface. We call it your popliteal surface. Okay. Then below, you have the condyles, shaft. So the medial and the lateral femoral condyle. Then at the extreme side of the condyles, you now have the epicondyles na buwak na ocelluary. So this will now be your lateral epicondyle. Then on the medial side, suppose you have the medial epicondyle. And then here sa submedial supracondylar ridge, nakakay mo protrude nga bony part there, and we call this one now your adductor tubercle. So you have your adductor tubercle siya. Okay? So this for your adductor magnus would insert as a medial supracondylar ridge. Okay, between the two condyles, you have this notch, and we call this notch now your intercondylar notch. The intercondylar notch. Okay, clear? Any question in regards to the femur? None.